everyone. We're here on Bella TV, and we're here with Dr. Schlessinger in Long Island from Schlessinger Eye and Face. Thank you so much for joining us.
Thanks for having me.
So a lot of our Bella readers are always asking us anti-aging questions, and we wanted to get your expertise today.
Great.
So can you suggest some non-surgical techniques that you would recommend for anti-aging?
Yeah, that's a question I could really talk about for a long time because there's so many great non-invasive anti-aging techniques that are available now. So I would say one of our top procedures that we do is we do a lot of fillers. And we have a lot of different fillers like Restylane, Juvederm, Belotero, Radiesse. So those are used to inject into the face, and we can get rid of lines, we can increase facial volume, we can enhance lips. Now we do a lot of eyelid rejuvenation with that. We also have Botox, which we've been doing for over 20 years now, so we can get rid of wrinkles and lines and really rejuvenate the upper face and sometimes in the lower face with Botox. Moving on from the injectables, we have a variety of different non-surgical type of lasers. So one of our really effective treatments are with Ulthera. So Ulthera uses ultrasound to heat up the deep layers of the skin. It causes the skin to tighten. We can raise brows. We can do a virtual facelift or a non-surgical facelift with very little pain, and it's very effective.
So when it comes to injectables, I know a lot of people always ask, how can we avoid looking unnatural or overdone?
Yeah, so that's a great question. So what makes you look unnatural? Obviously, if your lips are too full or too ducky, we want to obviously avoid that look. Yeah. I see women who come in here who have so much filler in their cheeks it looks like they have a shelf. That's an unnatural look, and we really try to avoid that. The key to avoiding the overdone look is what I call facial harmony. You want all the parts of the face to match each other. So if you're going to inject the lower face, you may want to look at the upper face as well. One of the areas that people miss is the temple area. And as people age, they actually lose volume in their temples, and it can look like what we call a peanut head. So if we're going to inject the cheeks, we also want to think about injecting the temples. So facial harmony is really important in looking natural and not overdone.
Okay, I know we've all seen a lot of overdone cheeks, so that's really good to know. And when it comes to lasers, what can we do about sun damage or improving your complexion?
That's a great question. I mean, this is a perfect time for people to think about rejuvenating their face because we're out of the sun in the Northeast. We have that luxury of not being in the sun in the winter. So we have very mild treatments from just chemical peels to intense pulse light or IPL treatments that really work well with little or no downtime to rejuvenate the skin and get rid of dark spots. And we also have a variety of other lasers, including our fractional CO2 lasers that are deeper peels that will get rid of not only sun damage, will also get rid of fine lines and wrinkles.
Okay. And what sets you apart from other doctors?
That's a great question. Thank you for asking that. So I'm an oculoplastic surgeon, so I'm board certified in ophthalmology, but then went on to do subspecialty training in oculoplastic surgery, which includes eyelid and facial cosmetic and reconstructive surgery. So here we really focus on cosmetic and reconstructive surgery of the face, and particularly around the eyelids. So we're not doing every part of the body here, we're really focusing on face.
Okay, so for example, what would you suggest for someone with eye bags?
So we luckily have a lot of different treatments, and that's why you would come here for our expert opinion.
Okay.
But we can do anything from sometimes there's Botox and fillers, and combine that with Ultherapy to get a non-surgical eyelid lift, and that can be done in a matter of minutes and with virtually no downtime. And then we can go all the way up to surgical procedures.
Okay. And what's one piece of anti-aging advice that you would give to everyone?
Well, what I would say is start young. Maintenance is easier than repairing, and use sunblock.
Okay. And when would you recommend lasers?
So it depends what you're using for. We do lasers in all different ages. So again, if somebody just wants a quick freshen up, we can do a very light peel, or we can do a photofacial with the IPL. or if somebody has really tremendous sun damage or acne scars or a lot of wrinkles, then we can go into a heavier lasers. So that's when we would use lasers.
Okay, and do you recommend frequent treatments or more like once a year?
It really depends. You know,
Okay.
there are maintenance types peels with intense pulse light. We can do maintenance, and there are people who come in frequently who get them every couple of months or twice a year or so. Where the deeper peels, we don't really recommend them being done that frequently, but maybe if you did a heavier peel, you could maintain it with some of the lighter peels or lighter treatments later on.
Okay, and then when sometimes, you can't use injectables or lasers, and people that prefer surgery, when would you recommend that as a treatment?
So there are people who are really not candidates for non-surgical, usually older people or people who have really heavy bags, and so those are people who need surgical removal of their bags. If the tissues are very loose, they need to be tightened, and they're not good candidates for non-surgical treatment. I think there are some people who would just be disappointed if they got filler or a non-surgical treatment. So we try to make sure that those people do the right procedure for them.
Okay, and are there any new technologies that you are excited to share with us?
Yeah, well, we have a lot of new technology here. I really feel like we're always on the cutting edge here. So, Ulthera, although it's a couple of years old, we consider that a newer technology that we get remarkable results on. We're also introducing more radiofrequency type of devices. So we have a microneedling radiofrequency device that is a great toning and tightening technique, and it's great for lines and it's great for acne scars. And we have different erbium YAG lasers and all different types of lasers to help rejuvenate your skin.
Okay, we've heard a lot about Ultherapy, but what exactly is it, and what kind of results can you expect?
So Ultherapy is a technology that uses ultrasound.
Okay.
It's an in-office, no downtime procedure. It can take anywhere from, depending on the areas that we treat, anywhere from 15 minutes up to an hour and a half for a full treatment.
Okay.
You can treat the upper face, the mid face. You can treat all the way down into the neck, even into the chest. The ultrasound is focused in the deeper layers of the tissue. It causes new collagen to grow, and as the new collagen grows, there's a tightening effect and a total rejuvenation. The effects aren't seen right away. You don't really see much result right away. It can take 3 to 6 months to see the final result, but we have very, very satisfied patients and really great results.
I've always heard that Ultherapy is supposed to be a non-surgical facelift.
Yes,
is that what you've seen?
Yes, that's people who are not candidates for facelifts or don't want to go through a facelift. We would do that, and sometimes we combine that with other treatments. So Ulthera can be combined with fillers, it can be combined with surgery, it can be combined with laser resurfacing. So it can either be a standalone or it can be used in combination with other treatments.
Okay, and what does the treatment usually feel like for the patient?
So Ulthera typically is a little bit uncomfortable.
Okay.
It's heat. One of the new technology brought into our office, which is not really so new, but it's new to us, is we now have a device called Pronox, which is a nitrous oxide machine. So the patient, while they're undergoing treatment, can take nitrous oxide, just like you would get at the dentist's office, and it makes an uncomfortable procedure not only tolerable, but maybe even enjoyable for the patient.
That sounds amazing. I would definitely want that if I was getting anything. Yeah, that's so great.
That's great.
Well, thank you so much for sharing all of your knowledge with us. It was so great to learn about this.
Oh, my pleasure. Thank you so much for being here.
And thank you all for tuning in. I hope you learned some great skincare tips, and we'll see you soon.